both the county judge and I issued extensions of the orders that have been in place now for about a month. The orders are the ones that have had us sheltering at home and only going out if you have to do something that's essential or critical. You may recall that the president's order goes through the end of April. The governor's order goes through the end of April with their orders. We went a week beyond that till May 8th. There are two things with this order that I just want to touch on that are different. The first, and I think most significant, is the provision that takes the recommendation we had been making about wearing face coverings for everyone when they go outside. It now makes that mandatory. It says something that each of us now need to be doing.
And a lot of people are asking us, why now? Why this step? Why is it mandatory? A percentage of individuals that are asymptomatic who have the ability to spread is larger than we thought it was. Those that have very, very mild symptoms where they may not even think they're sick or may not be severe enough for them to seek health care may be able to spread it. And we also have increasing evidence that early on in the disease, when people are asymptomatic or they have mild symptoms, may be in fact the time when they are most infectious. So for these reasons, it's critical for us to take this next step of mandatory masking or facial coverings to help mitigate that risk. Remember that these are cloth face coverings. These are not surgical masks. These are not N95s. You don't need this level of coverage if you're at the grocery store or if you're walking your dog or if you're going to the dry cleaners. You need a simple cloth face coverings. Remember that the purpose of these face coverings is not to protect you from other people. It's to protect other people from you in the circumstance that you may be asymptomatic with the disease or mildly symptomatic. Again, to give us that extra layer of protection.
Our second order, it does go through May 8th because we need that time to see, for instance, in the Unicast data with an Easter weekend spike in activity, it's probable that we're going to see a spike in cases 2 weeks later. We do know that there is a strong correlation between our behaviors and our numbers of cases. So we will be looking to see if we are getting a spike in cases 2 weeks hence.
The second provision that we had talked about enforcement and recognized that these kinds of orders carry with them criminal penalties and the force of law. But we also recognize that so much of these orders, as you have seen, require us to self-police, for us to, we're never going to have enough sheriffs or police officers to actually enforce this that way. It's got to be something that we want to do in the community, that we want to save lives around us. We want to help protect the people around us. And the hope and the expectation is that this is something that we will adopt as a community. And if we do that, then we're fine. If not, then obviously the county and the city are going to have to step up enforcement.
But it's something that we have to embrace. It's something we have to embrace now. It's something that's critical over the next 3-week period. That combined with social distancing may put us in a good position in 3 or 4 weeks to start opening the window a little bit, to start returning people back to work, returning businesses back to operation. But we cannot do that unless we really embrace that social distancing, unless we really embrace that facial masking, so that we can be in a situation where we just have a trickle of new cases coming in and we can effectively monitor and manage that risk for the community.
COVID-19 is not going away. We don't yet know exactly how the virus circulates in the community. We don't yet have a treatment or a vaccine. So with these uncertain times, we've had to take some dramatic and definite action. And this community has just been tremendous at responding in a way that is so effective. We will not be able to regulate and enforce our way out of COVID-19. But through innovation and adaptation and sharing, we will find new ways to do business, new ways to interact with one another that are satisfying, that are fortifying, and that help us save lives.